Okay, well, we are at the top of the hour and we have a very special guest today. So, welcome to all of you all who are joining us. I am Ernestine Briggs King, the current president of APSAC, and I am so pleased that for this 2024 Black History Month, we have a third installment of the contributions of African American pioneers in the field of child maltreatment. Um, Looking all the way back and also acknowledging the present, and that Joyce Thomas, a legend, a pioneer in her own right, is leading this conversation with us. She is president and CEO, co-founder of the Center for Child Protection and Family Support in Washington, D.C., and and a very dear friend and colleague. And so I'm going to turn it over to you, Joyce.
Okay, thank you, Ernestine, and welcome to everyone. This is just a pleasure to be here and an opportunity. We're just about at the last day of February, though this is a leap year, so we have one more day to celebrate Black History Month. And it's important that we do this. Crystal is going to manage the slides, and so unless I have opportunity to do that. So we can move to the next slide. I want to at least acknowledge that we are celebrating this of professionals who've made a significant contribution to understanding the field and serving abused and neglected children. And making sure that we recognize the contributions of individuals who have been with us and those we have lost along the way. It's extremely important to champion these pioneers. We are looking at those who have contributed in the area of research, practice, policymaking, education, as well as the accomplishments in the field as we look broadly at the nexus of issues that cross with children who are vulnerable. We want to recognize that this is a project of the American Professional Society on the abuse of children, and it's part of our commission to end systemic racism and implicit bias in child maltreatment work. This group came together well over 2 years. I think we were in the middle of the pandemic, and we recognized that there is a role for us to continue to look at, examine, review, and acknowledge the issues that are related to systemic racism and bias. And I believe we have it on our website, and the website is being updated so that we'll be able to talk about all of the work of the commission. Next slide, please. I'd like to start with the realization that history matters, and to make sure that we understand how I've gone about doing this. This is the third session. We had the first two sessions, last year and the previous year. And our goal was to recognize outstanding African-American practitioners. And at that time, I was focused on the 1970s and the early 1990s. My first case of child abuse occurred in 1965 when I was a young nurse in Oakland, California. And I would have never imagined, it was the worst case. It was, as many of us have experienced, some very unpleasant tragedies in working with children and families in stress. But I would have never mentioned that 60 years later, 50 years later, but certainly I'd still be focusing on this. It is a passion of mine to make sure that we acknowledge the wrongs that have been done and to put ourselves in a key position to improve the outcomes. The rationale is really for young providers or younger providers to understand whose shoulders we have stood on, who are the people who have made the contributions. Because oftentimes in this field and in other fields, they are either unknown, unacknowledged, and unrecognized. So it has been a pleasure to identify people who I know have made significant contributions. And I think the previous part one and part two hopefully will be on the website if it's not. But I want to acknowledge that this is our third attempt. Now, the selection of these pioneers in the field for this presentation and for the prior presentations are based on my long-term involvement in the field. It's not an exhaustive research due to constraints of time and resources. And so if anyone that I left out, I apologize for that in advance. But it's hard to believe that if there were a significant contributor to the field, that they have not crossed my path in terms of the services delivery, the research, the policies, and practice and education. The overarching goal really is to stimulate dialogue. So I want to leave some time in the end for us to really stimulate dialogue about the importance of celebrating and acknowledging pioneers. These are trailblazers. These are individuals who I hold in great high esteem. Next slide, please. Now, I want to start out with an individual who has long since been known as a scholar, as a provocative orator, and an individual who has made us think long and hard about the issues of treatment of children in the child welfare system. Dorothy Roberts is an acclaimed scholar on race, gender, and social justice. She graduated in 1977 with her bachelor's degree, and she was magna cum laude from Yale. Right 3 years after that, she graduated from Harvard Law School. And for the next year, she served as a law clerk for the Honorable Constance Baker Motley in the U.S. District Court of the Southern District in New York. This is a huge accomplishment for attorneys. And it's important to recognize that these individuals come with great stature of their past and their future. Dorothy has published well over 50 articles and essays and books in scholarly journals, newspapers, and magazines. Next slide, please. And it's hard to put all of this down on a PowerPoint, but I remember Dorothy's lecture when she came to the Institute on Domestic Violence, and her ability to fire us up, those of us who were doing the work, to really look at not only the good that's being done, but the untoward outcomes, particularly for children in the child welfare system. This was back at a time where there was huge numbers of children, overrepresentation of African-American children, situations where children were getting lost in the system, they were languishing in the system, and all of this was due to the fact that many of the systems and the policies and the procedures were not geared up to meet the needs of families who were struggling. The largest number of cases involved children with neglect, and the largest number of children with neglect were primarily African American and Native American children. So this flooded the system. Dorothy is a renowned attorney, and she was at the University of Pennsylvania Law School. She was at Northwestern. She's at Stanford and Fordham. All of these represent the kind of scholarly approach that she takes to looking at issues and to understanding and studying such issues. Next slide, please. I wanted to feature some of her work, and obviously not all of it, but one of her major contributions is the book Shattered Bonds, The Color of Child Welfare. And this really, though it has been recognized by many in the field as dated in terms, but it really tells us what the child welfare system was like in the early 70s, 80s, 90s, and almost up to the present. Even here in the District of Columbia, our child welfare system was under receivership for over 30 years when we had the LaShawn receivership here in DC. And this was a situation where children were harmed while in the care of the government agencies. This book is about foster care in the United States, and it does paint a bleak picture. And I particularly wanted to see the timing of this because some things have changed, some things have improved. There is more emphasis on prevention now. There is more recognition that all children don't need to be removed from their homes. There's a lot we have learned, but we need to understand where we've come from. Again, largely Black children and parents where these kids were removed from their home. And many times poverty was the underlying factor. Because of Dorothy's tremendous ability to be a scholar, she used research to tell us about the well-known tragedies in America as it relates to the child welfare system. And thousands of children, again, were removed every year from their homes due to neglect, which was intertwined with not only poverty, but substance abuse and other factors, homelessness as well. Next slide, please. Her more recent book, which is in 2022, does not let the child welfare escape at all. In fact, she builds on the controversies, she builds on the realization, and she has come to a stark decision. Now, this is not a decision that's well held by many in the field because her approach would be to abolish the child welfare system and let's start over. This is still raising a lot of eyebrows in terms of individuals in public agencies and private agencies. And it's a topic worth discussing. But I do know that there are many things underway in the Department of Health and Human Services, in the communities, the community-based efforts, the coordination of in-home care. All of these factors probably would not have come about if someone did not really paint the realization that the system, as initially designed, was not effective. I wanted us to start with Dorothy's work, to think about it, and to hopefully engage in some discussion. We don't need to take sides, but we need to really look at what else can be done for this population. And we have talked about this in previous presentations. We've had public child welfare leaders on this particular program to recognize that some of the policies that were developed and produced were all in good favor, but there are many untoward negative outcomes that still prevail that are worthy of us continuing to look at this issue. And it's work by individuals like Dorothy Roberts who stimulate our thinking and force us to come up with approaches that will be more in design with the welfare of all children, and particularly those vulnerable children. Next slide. Now, moving forward, I want to really, this is a wonderful woman. Her name is Dr. Annie Brown. Annie was a very good friend of mine. I met Annie when she was first working in the community, and she worked at a mental health center. And I watched her develop and move forward. And we became great colleagues as she began to do her research. She was an associate professor. She's now retired from Howard University School of Social Work. And she joined the faculty back in the early 90s. But I actually knew her when I was at Children's Hospital, which was in the very late 80s. She earned her bachelor's degree from Dillard University in New Orleans and received her master's in social work from George Warren Brown School of Social Work at Washington University in St. Louis. She received her doctorate from Howard University, and her research and publications are in the area of mental health, adolescence, female violence, child welfare, and social welfare history and international social welfare. Now, Annie worked very, very closely with our next scholar and our next individual. So I'm going to do the two of them together. Next slide, please. And that is my dear, dear friend, departed, is Miss Ruby Morton Gordine. It was shocking that we lost Ruby just a year and a half ago, almost 2 years now. But Ruby was also a professor at Howard University. She graduated from Howard in '69 and also got her MSW and her doctorate. She got her doctorate at Howard. She got her MSW at Atlanta University. She was appointed the head of the field education and worked very closely with the Center for Child Protection and Family Support. But she traveled nationally and internationally. And actually, the three of us, which was Annie, Ruby, and I, had many, many, many long discussions. And those are where you really, really learn what people's values are and their thoughts when you have those opportunities to share. Next slide. Next slide, please. Yes. And the topic that we spent a lot of time with, and these articles were co-authored by Dr. Annie Brown and Ruby Gordine. So I put them together because I didn't want to duplicate them. But I remember when we really started wondering and worrying about teenage girls and violence and the whole coming of age in the urban community. This was back in the late 90s, where the more violence we saw on the street, the more we saw young girls, particularly teens. Many of these youngsters were victims or prior victims of abuse and neglect. And we wanted to really look at the exposure of violence and the fear of violence as it relates to their anger and their behaviors. And so Annie and Ruby did a small study of about 30 teens, and this was published. I believe these slides will be made available, and all of the information that has been researched for this presentation is public information. So I think it would be worthy to look back at other works that they had accomplished. But we were just really fascinated by the lack of discussion because the high death rates of African American males sometimes meant that we did not focus on the violence maintained and the impact of the health on girls. So they did these very, very early studies and began to generate a lot of discussion, particularly in terms of dating violence, being victims of dating violence, really looking at just the whole conversation between teens, Black males and Black females, and their work as it relates to dating and dating violence and how they protect themselves and what they do. The facts and the fictions that really came out related to this kept us moving in a direction of really trying to understand why Black girls were as vulnerable as young Black boys. Also, Annie and Ruby, and I call them by their first name because they were colleagues, very dear friends. This is done to familiarize you more with the closeness that I had, and many of these individuals help um, perform the kinds of studies that allowed me in my community-based facility to have the latest thinking in terms of program direction, mentoring, and the kinds of things that need to be done on the ground. We got from very early work. The other things that both Dr. Gordine and Dr. Brown focus on was looking at issues of older children in the foster care system. This is a continuing concern even today, that kids are getting out of the foster care system, um, not prepared to function. Um, so they developed a research project where they were looking at both anecdotal stories for contextual understanding, as well as working with and observing how youth in the foster care system experience the kinds of surroundings that they had. So these two researchers and practitioners brought to us, really, again, building on prior work, the fact that we need to look a little more closely, and sometimes to do that, we do small studies as well as to really look at things that are happening right in our communities, and really looking at those efforts. Next slide, please. I'm moving on because this presentation is about the people. It's about the people who stood out in the early days and who are still practicing today. And if you were here in this Washington metropolitan area, every single meeting that is discussing policies and programs related to child welfare, Tricia Bent Goodley has been present and has been a strong voice to recognize the things that we need to understand as we move forward. Tricia received her bachelor, her doctorate degree in social work and planning and analysis from Columbia University in New York City. She received her master's from the University of Pennsylvania, and she currently is a professor emeritus at Howard University School of Social Work. She has an amazing career where she was not only in the School of Social Work, but also a graduate professor at the University, Howard University Public Health Program. And through that, Tricia branched out to many other areas. And currently, she is serving as a clinician for our Baltimore Ravens, which is one of my favorite activities is watching football. But she's in the clinical area working with individuals there. Next slide. Tricia has made a profound contribution to research. She has a very long list. I think she's published over 80 articles. So to pick out a few is daunting for me, but it was important to recognize that she helped us look at some of these crossover issues of whether child welfare and domestic violence, how they interact and intertwine. She was beginning to look at some of, again, the challenges of contemporary foster care system, where she pointed out, again, there was always a desire to find the meaning and the recognition of the children left in the system. Children were not getting the care they need. Whether domestic violence and kinship care made a difference, particularly in policies and practices, and certainly looking at the policies in child welfare and as it reflects on African American families. Each one of these articles that she's written and each one of these topics could be an entire workshop. But this is really to recognize that we like to put things in neat little packages, but we can't separate out domestic violence. You can't help children unless you help their parents. And so this information by Tricia really brought this home to all of us. And it's an important piece of the puzzle, really, to help look at prevention. And this is one of the areas that she focused on. Next slide. She also produced two very amazing publications, one of them in the interpersonal violence in social work, and also really looking at domestic violence. She has done a lot of work with the Institute, and I had the pleasure of writing with her on several articles that looked at African American children who were victims of watching or seeing domestic violence in their home. Next slide, please. And I'm moving on now to Beverly Jones. Beverly Jones is a social worker for many years, and she is still practicing. Beverly received her bachelor's degree in sociology from Douglas College at Rutgers University, and her master's and postmaster's at the University of Maryland. I met Beverly over 40 years ago, and we worked on a project at Harvard University, which was we call it moving from here to there. How do we move the child welfare system from where it was, which was chaotic, disruptive, sometimes harmful to children, to where we can envision a more family-friendly. And it's not easy to make those transitions, because all along the way, the approach of trying to keep children safe is utmost in the hearts and minds of providers. I met Beverly when she was at Baltimore City Department of Social Services. In fact, one of the first studies that the Center for Child Protection had done was looking at social work intervention in child abuse cases. At what point they received supervision, at what point did they make critical decisions about removing children. And we work with the American Humane Association to really look at the assessment tools that were developed, and many of these tools are in operation today. Currently, Beverly is a vice president and chief operating officer at Lutheran Child and Family Services in Illinois. And Beverly has just been a steadfast, committed, dedicated social worker who has been in this business for a very long time and has created a number of important contributions to the field. Next slide, please. And I wanted to just point out some of her leadership roles, because sometimes when you're not in academia, your leadership practices make a big difference in policy work. And so she was the deputy division director of programs and policy in Atlanta, Georgia. She was also at Fulton County Department of Social Services in Atlanta. She also was assistant commissioner for the Division of Learning and Development in New Jersey Department, and also in Arkansas. I believe she, while she was in Arkansas, she came to the attention of then Governor Bill Clinton, who appointed her to a panel. And this is when I met her, when they were looking at experts in the field to really look at the current system again and make recommendations. All along the way, of all the things that we say don't work about child welfare, there were many African American professionals and providers who were attempting to address this, both from a professional point of view and a personal point of view, because there was a close identification. As a result of this, she was able to look at and revise and do some oversight work in Little Rock, Arkansas, in the child welfare system. And many of these models are used throughout the country. Next slide, please. Now, this individual, which is Dr. Barbara Staggers, has been a long time colleague and friend. She is a pediatrician, and she is a renowned pediatrician who focuses on adolescent medicine. The story with Barbara is I had known her parents, both of her parents, were physicians, and they worked for the Navy. And when I was in the United States Navy, um, I had an opportunity to work with the officers. I was enlisted, and I babysat Barbara. And it was years later that we met and we became very, very close because she was really in the same area of interest, which is pediatrics. She was at the Children's Hospital um, in Oakland. And she was very clear of working. She was very clear about working with at-risk kids. And so she's practiced for over 37 years. She is a trailblazer in pediatrics because she was devoted to how medicine was very, very important in healthcare, even to children who've been victimized. And she started looking at how systems, even the child welfare system, should begin to not only deal with the social issues that children present with, but how many of these children had healthcare needs. And it was the early work of how to work with adolescents that she developed just hundreds of curriculum materials, has been on numerous panels and received numerous awards about how to work with high-risk kids who have had a history of victimization and a history of being individuals who require not only the mental health services, but the healthcare services. Kids who had asthma, kids who had diabetes, and who were also in our child welfare system. And her early work really began to make child welfare system, again, add and look at the healthcare needs and coordinate more closely with the medical facilities. And certainly even here in the District of Columbia, they hired health providers in the child welfare system to make sure that the screening is done at the time that children came into the child welfare system, to look at their health care needs, and look at their providers of health care. She has a background in public health as well as medicine, and her contributions, her discussions, her participation in conferences and forums throughout the country has really provided the leadership for many physicians who, sometimes tend to compartmentalize the healthcare needs of children. Next slide. Barbara was very, very, very active in the community, and she is really considered a national authority on urban youth and looking at gun violence and looking at issues of bullying and looking at issues, again, of how to look and treat multicultural societies. She also was very instrumental in and was the founder of the very first school-based health center in the nation, which is at Fremont High School in Oakland, California. Oakland is an area that I was in when I was in my early years of practice as a nurse. And it was adjacent to where I went to school, which was University of California, Berkeley School of Public Health. And this is a time when it was really not understood what public health practice was all about and how public health really is the broad picture of looking at all of our health, not only the individual client, but certainly communities, institutions. And Barbara was very instrumental in that. Um, I was very pleased community work. And this is where the early work was done by the Black Nurses Association. And my dear colleague and now friend, Dr. Carlisa Hussein, again, was instrumental in helping us look at how these factors really, again, help prevent some of the things that we're calling child maltreatment. And this prevention really means that we have many opportunities to go broadly in a number of areas. Next slide. My next person that I would present is, again, Dr. Esther Jenkins. And Esther is currently retired. She's a specialist in mental health, has done a lot of work on psychological trauma. She received her bachelor's degree from Northwestern University, and did a lot of research, private research, which is a private research institution in Evanston, Illinois. And she earned her master's and her PhD from the University of Michigan in Ann Arbor. Esther was a member of the steering committee on domestic violence in the African American community. And she and I were great colleagues. Even today, we're close friends. As she is retired, I try to keep her up on all the things that I'm still doing. And one day I'm going to sit down and watch all the things other people are doing. But she has an extensive background in research and teaching. She worked very closely with the late Carl Bell in Chicago. And next slide. And has really provided us with just tons of literature as it relates to, again, violence and trauma in the African American community. And these early works were done in the early 90s, in the early 2000s, looking at this whole notion of the long-term effects, which is trauma and in children and stress, and how we should begin to focus on these areas. And this kind of spilled over to looking at this exposure to violence, because oftentimes it was a question of whether or not you actually in a situation where you are being a victim, but we recognize that exposure to violence and the cumulative exposure to violence is very harmful to kids. It results in toxic stress. And this, the studies that Esther has done, the early work and her current work, as I mentioned, with the Institute on Domestic Violence, really reminds us of how important it is to focus on exposure to violence in the field. Esther is currently retired. She has done a lot of studies and a lot of work with the proceedings for the Institute on Domestic Violence, and certainly has published extensively. And she's just an amazing person, a good friend, and a tremendous colleague, and a pioneer for all of us thinking through what we are doing and where we are going. Next slide, please. And I wanted to mention a person who is right here again in the DC area, Dr. Reverend Wanda Thompson. Wanda was received her bachelor's degree from Dickinson College in Pennsylvania, and her master's from Temple University. She is a licensed clinical psychologist, and she operates primarily in the DC and Maryland area, but she's far more invested throughout the country. She has worked with the DC Medical Society, again, looking at abuse and neglect. She has practiced at Children's Hospital in Washington, DC for well over, I believe, 20 years. I couldn't find an exact time on that. But when she retired, she went into the ministry. And in the ministry, she focuses, again, on the community and the community's work. Next slide, please. And she has not given up devoting her time and her energy to the issues of child maltreatment. She was a longtime trainer for the Child Abuse and Neglect Training Institute, which was a program out of our organization and center. And she also was just recently, within the last 2 years, appointed to the Citizen Review Panel here in DC. She maintains a private practice. She is really an expert on the impact of mental health impact of violence and victimization of children. And her population is primarily African American children. And she serves an expert witness in court throughout the country, looking at the implications of the psychological trauma and the treatment needs. She's a clinician who does, in fact, practice, trains, and does community advocacy throughout this area and throughout the country, and is worthy of being included as a very strong pioneer in child maltreatment throughout the country. Next slide. And last but not least is Dr. Oliver Williams. I'd be remiss if I did not include him. Oliver is a dear, dear friend of mine for many years, and he always says that I mentored him when he was wet behind the ears. Now he's retiring, so that really pushes me into super retirement. Oliver is a professor currently at the School of Social Work at the University of Minnesota, and he received his bachelor's degree from Michigan State and his master's from Western Michigan State in Kalamazoo. His PhD he received from the University of Pittsburgh. I met Oliver when he was just leaving the University of Pittsburgh, and he was a quiet person sitting in the corner. And I said, you are really, I was so blown away by his accomplishments, and we talked about it a lot at that time. He is a clinician, and he is currently, well, he's not currently because it's now not existing, but he was the director of our Institute on Domestic Violence. Oliver did a lot of training. He started out as a child welfare worker. He did a lot of training on cultural issues in child maltreatment. He actually went around the country with many of my colleagues who were looking at the whole problems of children of color in the child welfare system and the need to improve the services and the policies that affect them. Next slide. His major contributions have been, as he focused, as I mentioned, he was in the field for many, many years. He was the executive director of the Institute on Domestic Violence, and that's a whole unique program on its own that's worthy of really having some time with APSAC to really look at that crossover between domestic violence and child abuse. But he also was involved in training and the delivery of services. He has many, many projects of interest, including projects looking at safe return, individuals returning from prison who were involved in domestic violence situation. And his big concern is around issues of fatherhood. And we cannot, again, eradicate the problems of child abuse and domestic violence unless we interact with all members of the family, including the fathers as well as the mothers. Next slide, please. I just had, Oliver had so many publications. I just had selected ones to bring to your attention. And the big one is his work, again, Parenting by Men Who Batter, because that is really kind of the hallmark of understanding how we address issues of many times men have to return to parenting and the underlying factors associated with communicating with the spouse or the ex-spouse or the girlfriend or the child's mother really was very difficult to know how do you get those boundaries together. He also did major work in the area of reentry, and he did a lot of work around the whole notion of working with battered men. And again, these are elements that go into prevention and intervention. Next slide. We have just presented 9 of the scholars, practitioners, educators, researchers who have been instrumental, in my mind, of deserving to be recognized during this Black History Month. Um, I want to thank APSAC for helping to promote this presentation, to always be there and ready to support us, acknowledging individuals who have been certainly recognized, but to be recognized in this arena as pioneers, as historians, as individuals who make a huge difference. And I want to thank those individuals who I hope maybe some are on the call and will dialogue with us on any questions that might come up. But I certainly want to make sure that we recognize their contribution in this field as we move forward in our work of trying to support and prevent child abuse and neglect. And certainly want to, again, thank all of you in attendance. And I hope that we can have the remaining, I think I have 10 minutes left. Yes, I do. I hope that we can have some discussion, at least briefly, and certainly would follow up on anything or any question that you might have. This was a labor of love. This was really taking time to think back and reflect on the work of others, and to appreciate that work and to acknowledge that work and to share that work. So I thank you for being part of this. I think this is the last slide. So Ernestine, we can open it up for questions. And if there was anything in the chat that we want to highlight.
So I just wanted to say thank you for the gift of this labor of love, that this history is so rich, and maybe things that we don't often see in our textbooks and in our learning. And so I think for our next generations, it's important to really kind of curate this history. So thank you, Joyce, for doing this work. And all the special people that you mentioned, many of them are in the room. And you got some other special guests like Dr. Martin Finkel, who showed up and is
Hello,
waving
Joyce.
to you.
Nice to
Hi,
see
Mike.
you.
How are you? My gosh.
So much fond memories of those early days where we
Yes.
had this energy, enthusiasm, and drive to form a field, and you were at the helm. And I have fond memories of you embracing medicine. Where there are a lot of people who wanted to embrace medicine, and the collaborative nature of all your work and accomplishments. You're a beacon of light, and and just proud to know you.
Thank you, thank you, thank you. Yes, we go back a long, long way. I won't ask about your kids. You'll have to call and tell me. I know they're all grown up and whatnot and so forth. But thank you so much. I learned from those interactions because I was in a situation where there weren't very many. In fact, I can't think of too many other nurses who were that intimate in the field of child maltreatment, but certainly is the case now, which is, it's a credit that all disciplines, no one owns this. It's
Right.
the kind of field that each specialty brings and contributes. And Martin, you were just certainly so much a part of that. And I thank you for everything that you have done and just being a friend.
Thank you. Thank you. Best wishes.
Thanks.
Yeah. Dr. Esther Jenkins was on, and unfortunate she left, but Dr. Wanda Thompson is on. I don't know if you want to
I
say
do.
anything.
Hi, Wanda.
Hi, Joyce, and
I could never say enough good things about you.
oh,
I mean, when you used to come and do the training, I mean, people were in awe, and it just spoke of your confidence and your knowledge base there at Children's and around the country. And I totally appreciate you stepping up when I reached out for you to join the Citizens Review panel. I know I haven't
yeah.
checked back in to see what they've done with you, but you know, you are a legend, and you should be exposed to all the good things that people know about this field. And there are those of us who are running around all the time, but we do not run around without having the knowledge and the support that you have given me for, oh my goodness, too many years. So thank you, thank you, thank you.
Well, I'm happy to be here today, but I say that we would have to put you at the top of the list of people who are pioneers in this field. And it just, when I think about the fact that I came to Children's Hospital back in the mid 80s, that, when we think about the fact that we're 40 years past that and still dealing with the issues of child maltreatment, it really speaks to a lot of things going on in our society. So we have to continue to keep working at it. And particularly in my interest in the Citizens Review Panel is in children in care and reunification. Because, and I've often said that no matter how wonderful a foster home is, most children want to be in their homes with their biological parents. So there's a lot of work still to be done to try to work on prevention, providing in-home services, perhaps to families, and and just in general helping families out. So thank you for being there. You are a role model for all of us, and I greatly appreciate you too.
Thank you. Thank you so much. Well, I just know that you'll continue to march on, but I want to also say we have to bring others along. We need to mentor these young professionals, and I am just so thrilled that I'm still doing that because I was mentored by the best. My dear professor from Berkeley has been my life friend, and she has mentored so many. I see her waving. Carlisa Hussein, it really is a testament to the fact that you have to keep reaching back and making sure, because none of us are going to be here forever. So thank you for saying that. And yes, the work continues. And I'm just delighted that I'm able to sit here and enjoy it all. And as an octogenarian, I have to mention that. And but it does mean that the younger generation and the not so young generation, they're plugging along just as well. So thank you, Wanda. Any other questions, comments?
What's your secret? What's the secret juice that you kept you going?
Passion, belief. And I have to say, it's pretty deep. I come from a large family. I grew up in Harlem in New York City. I had wonderful parents who guided me and kept me out of harm's way. I have wonderful children today who have just emulated that. And it's really just being happy and or trying to stay happy in a world that is so troubled. um, that's the secret to me. It's just being here. It's not easy, and yeah, I do get tired, um, but I do really feel that someone has to speak for the vulnerable. And I had the wonderful honor of being mentored by some of the best that we talked about in the previous two sessions. Um, and you watch people come and you watch them go, and eventually, that's my secret, is really caring that things can get better, and being surrounded by people who care um, makes a big difference. I could write a book on that one.
Well, we don't have any questions, but Cece, I don't know if you want to come off mute and share your comment. She put a comment in the chat around being from Ohio in a county run child welfare system where 75% of the kids in care are Black. And
which is
you know,
unbelievable, totally
yeah.
unbelievable. And, considering the history that you just provided to us, I would think that child protection would have it together by now. And unfortunately, they don't. I'm involved as a trainer, in our child welfare system and, consulting kind of stuff. But yeah, And I know our state is supposed to be trying to do things, to make people more diversity competent so that, their own biases are not, leading them. And I think that in that particular county, the majority of the social workers are Caucasian. And some of them are very young. Shoot, some still live in their mama's house. That's how young they are.
Right.
And oh, I don't know.
Well, don't get discouraged. This has been going on way before we came along.
Oh,
It,
yeah.
and each one person can make a difference.
Mhm.
I remember my early work in California in the community with other nurses who were looking at the free breakfast programs that did not exist, trying to understand kids who were involved in all kinds of adverse activities, shall we say, and how do you work with them? It's an ongoing thing, and it's not going to go away. And each generation kind of presents itself differently, but
Yes.
we do have to protect children because the one thing that we can say, and I'm not sure if the data is totally true on this because we had a pandemic and we lost a lot of opportunities to work with families, but the numbers are going down in child welfare agencies. There are more prevention programs that are well evaluated and have demonstrated outcomes that work.
Yeah.
There are situations where the community groups are coordinating more. I spent 10 years in the child welfare, and that was kind of unheard of, to bring different disciplines into the child welfare system. Usually it's a social worker because it was considered a social problem, but it's a problem. And I think each of us do what we can for a little bit. And I think that we need
Absolutely.
to acknowledge that.
Yes. Yeah, I'm not discouraged. I'm just disappointed. I've been hanging around in child welfare for like 31 years now. And
By 50.
see, there you go. There you go. So
Yeah.
you knew about it before I even did.
Yes. Yeah. It is. It's hard. It's definitely
Yeah.
hard. I don't have a magic wand. No one does. I just know that there's some really caring people who are doing this work, continue to do this work, who are setting up programs. I am just delighted. I've been to conferences in San Diego and New Orleans, and there is a lot of energy, and we just need to keep that going because when that's not there, then we're really in a worse shape.
Absolutely.
Thank you for
Absolutely.
sharing that.
I thank you all. I just want to echo what Khalesia Hussein said. Let's vote. Let's get moving. Let's show action. And thank you all my friends for joining us today. Thank